Hi guys, welcome back. It's Dr. Saru. How are you? Today we start with our medical series. I know we had that video in. If you've not watched last week's video, please go down up or heave or two, you'll find it. Go to my videos on my page and click the latest video, which is for last year, or rather it's this year's, but we were talking about last year's events. So welcome back.
I grew up in a place where they told you what to chase, told you how to run the race.
So we're talking about anemia, and before I go there, this beautiful dress, I've been dressed with a fashion line called Clothina, and yeah, I like every aspect of it. It has a bit of some skin showing here, and it's also like a nice turtleneck, which is really brilliant. I'll link the page and under the description below, so that in case you like such dresses or others, you can just check their page and see whatever it is that will suit you. So today we're talking about anemia. I don't know if most people know what it is, or just there's a misconception about when you're being told either your HB is low, or maybe you're being told you've lost blood. What is the difference between the two? Maybe we can debunk that and know exactly what it is. So anemia is a condition which you lack enough healthy red blood cells to carry adequate oxygen to the organs that you need, because you know we run on oxygen, right? So sometimes one of the reasons as to why you can get anemia, maybe your body cannot make enough hemoglobin, which is part of the component of the red blood cell, or maybe it makes the hemoglobin but it doesn't work correctly, or maybe your body does not have enough red blood cells to begin with, or maybe your body keeps on breaking the red blood cells before their maturity, which is 120 days. So you see, there's so many aspects to what could bring about anemia, but we're not going to go into the deep medical facts about it. I'll try to make it as simpler as possible so that mtu yoyote aweze kuelewa what we're talking about kuhusu anemia. The incidence are about 30% of the total general population wako na anemia. So when was the last time you got your HB checked, or maybe even did a full hemogram to identify if you have some sort of anemia or not? So what are the causes? Some of the most commonest causes is dietary lack. You see, mara nyingi you see daktari anakwambia damu yako inakaa kidogo, kula mchicha, kula spinach. And it's because sometimes we neglect these foods that have those minerals or micronutrients which will help the body to generate its own HB, or make its own red blood cells, or nourish them and make them work the way they're supposed to be working. So when you're lacking in some aspect of your dietary or your diet, that is when it is one of the most commonest reasons for actually getting anemia. Another reason is inherited blood disorders, like sickle cell anemia or thalassemia. And then the hemolytic condition. Sometimes hata ukipata malaria ikikuwa mbaya unaweza kuanza kupata hemolysis. Dengue fever pia to some aspect is a hemolytic fever. So hizo ni inamaanisha it breaks down your red blood cells. So unaona hazitafika ile maturity ambayo ilikuwa inafaa ifike ambayo 120 days, ambayo can bring about you getting anemia. Blood loss. Umepata accident ama labda wewe ni mwanamke ambaye you get very heavy menses. It is one of the causes that can lead to anemia. It's very common, especially in women of their reproductive age, when they have some issues with their hormones. They keep bleeding a lot during their monthly period, and in turn they get to have such issues like hizo anemia sasa. Chronic illnesses, wale ambao wako na ugonjwa ambazo ni ugonjwa ambao it stays for too long, like it's a prolonged disease. Maybe it's something like TB, something like HIV, something like cancer. Those are chronic illnesses. Sometimes there's something called anemia of chronic disease, of which, because of the fact that you have ailments, an ailment that is taken a toll on your body for a long time, then you tend to have what? To get anemia. So who are the people who are in risk? Which is the risk population of getting anemia, or the vulnerable group? Like I already told you before, 1, women in their reproductive age, because of menses ama during childbirth. kuna kitu kinaitwa APH. Kwanza kubleed kabla you've given birth ama you've delivered, and then there's PPH just before or after you have delivered getting bleeding. So in such circumstances, women in general tend to be more prone to getting anemia as opposed to men because of those two factors, especially in the women in their reproductive age. Children and infants, mostly because of dietary lack in most cases. That is why, and not a lack of supplementation when maybe you have been told ya mtoto anahitaji kusupplementiwa labda iron or something so that they can be able to come out of that state of anemia. And then people who are on blood thinners. For example, you had a clot somewhere in your body and then daktari amekupatia dawa za kufanya damu iwe nyepesi. So such people tend to sometimes have some bleeding tendencies in which pia inaweza kulead wafanye nini? Wapate anemia. So how will you know you have anemia from home? Like you've not been tested or anything. What are some of the things that would make you feel or think, maybe I should go to the hospital and get my blood checked? Could be I have anemia or not. I don't know, but I don't want to wait around to check to see what it could be. So you just decide, I'll do this and I'm going to get checked. 1, dizziness. Especially when you're from a sitting position, you're trying to stand. It gets worse, of course, progressively, because in wakati maybe you're trying to stand from a sitting position, you get to feel a bit dizzy. It could be pia when you're just standing and all of a sudden unaanza kusikia like you're about to fall down. So that is 1. 2, sore tongue. You get your, especially with iron deficiency, yeah, anemia, you find your tongue is very sore, ama ni kama inapata tu vidonda sometimes. Sometimes you can even get some 2 ulcers at the corner of, at the angle of your mouth. The other thing is headaches. You get frequent headaches zenye hata ukimeza dawa sometimes it just disappear for a while and then it come back. After if you drink water, you still not feel any difference. Pale or dry skin. Your hand should be, I hope my hand looks doesn't look anemic, yeah? I hope my hand is as pink as possible, possibly could be. You definitely need to check if your hand looks a bit pale or white, that is, it's not as pink as I've shown with mine. I hope mine looks that way, but I'm told yes. So if you start to see as if you're losing color on your skin or on your hands, especially areas where you can clearly see, then definitely maybe you could be anemic. Perception of, or rather perceiving your heart beating. You know, like right now we're all seated. Our hearts are beating very, very okay within the range that is allocated. But you don't feel it. So here you feel heartbeat yako, ama your perception kama una feel heartbeat yako into palpitation. So that if you start feeling like you're getting palpitations, ama unajishika, sometimes you feel, why is it like my heart is racing this much? You're having tachycardia. Could be you're anemic. It's good to check out with your doctor. The other thing, restless leg syndrome. Huwezi kuweka miguu at one point, you just feel like you need to be shaking your legs all the time. It could be an indication that you have anemia. So, with anemia, now we have known the causes, we know who are at risk of getting it, we know some of the reasons, we know how would you tell if you're having anemia from home. I would like to engage you in something kidogo tu, so that you know there are different types of anemia. So usije ukafikiria like somebody else was told they have anemia and they were given iron, for example, where you start having the symptoms, you assume automatically you have anemia, so you also go buy iron when you don't know which type of anemia you could be having. There are different types of anemia, and that's why it's important to go to your facility. The doctor will at least take a history of you. They'll know some of the tendencies and behaviors that you have been presenting with, and then they'll do a full count, blood count, and that would be able to establish, to know, and also a proper examination which kind of anemia it is that you're suffering from. So the types are this one, iron deficiency anemia, where that it's just self-explanatory. It means there's anemia iron iko kidogo ndio imesababisha anemia ikue hapo. Then there's pernicious anemia, there's hemolytic anemia, there's sickle cell anemia. These are those disorders I was telling you, blood disorders, the inherited blood disorders. There's aplastic anemia. There's so many other types of anemia but I just wanted to run at least these five because they're the most commonest of all in this region that we are at. Yeah. So to just wrap up this discussion, what are the complications of anemia? So anemia on its own can lead to heart disease. Anemia on its own can lead to infection because now you have less of the blood that we're talking about, not the actual quantity, the volume, but now maybe the RBCs or the HP is low. You're more susceptible to getting infections. And then there's obvious this behavior where people start to eat things that are not of any nutritional value, like ice cubes or stones, the pica behavior. You could also develop that, which is one of the complications of anemia. And of course, the final, which is the most lethal complication of it, is death. So before you take it lightly when maybe you stand up from a sitting position, or you start feeling dizzy, or you maybe have very heavy menses, but you've never had any symptoms of anemia, it is always good to go to your doctor and explain these things so that maybe they can help assess you further and know if there's a way that they can intervene other than you losing so much blood and not knowing if you're getting anemic. So until next Friday, it's Dr. Saru. Love and love.